The chair now calls Heather Katiba. Please state your name and position on the bill.
Each of you will receive a brief copy of the American Association of Veterinary State Boards model for licensing boards. My name is Heather Katiba, and I oppose House Bill 2787. Veterinarians are a licensed medical provider regulated under Texas Occupations and Administrative Code, the Health Professionals Council, the Department of State Health Services, and a multitude of other state and federal entities. The veterinary board's compact with Texas states its foremost role is to protect the public. House Bill 2787 is not about public protection. It's a strategy to modify consumer and owner communication. This bill positions Texans to forfeit medical privacy and privilege, a position that counters the stance of existing law in every medical profession and quite possibly in every state in the U.S. Simultaneously, this bill dilutes the validity of a Texas veterinary license. It declares in bold print to every Texas veterinarian, 1, there is no minimum standard of ethics. 2, you are not equals to your counterparts in medicine. 3, your part in preserving public trust is an inconvenient responsibility. This perception undermines the public's confidence in professional regulation, and rightfully so. Confidentiality is central to the preservation of trust between doctors, caregivers, and patients. The foundation is consequentialist. It is to improve patient welfare with no qualifier. In order to ensure the general public maintains a level of trust in each particular professional field, states have a latitude to define minimum acceptable standards. Surely, Texas should have some standard. The American Association of Veterinary State Boards reaches licensing bodies in 62 jurisdictions. One is our state veterinary board. AAVSB cites protection of the public and ethics and integrity as two of its most integral benchmarks for itself. Regulatory boards and practitioners, citing exclusively in their Model Veterinary Practice Act, and I quote, any person having access to patient medical records or anyone who participates in providing veterinary medical services or who is supervised by a veterinarian is similarly bound to regard all information and communication as confidential. In close, I'm going to leave you with some words from a woman, a pioneer, and a respected practitioner. The foundation of excellence is character. I think one has to have integrity. There are so many challenges on a daily basis, and you just have to have integrity. Not only to earn and keep the respect of your clients, but also of your colleagues. You also have to have compassion. I can't imagine being in the health profession without having compassion, said Dr. Eleanor Green, Carl B. King, Dean of Veterinary Medicine at Texas A&M.